It's wonderful to have all of you here with us tonight. My name is Paige Bellenbaum. I'm a social worker and I'm the founding director of the Motherhood Center. PMADs, or perinatal mood and anxiety disorders, are a group of illnesses that impact at least 1 in 5 women during pregnancy and in the postpartum period. PMADs include perinatal depression. This could be having low mood, sadness, feeling helpless or hopeless. Again, we're going to go into greater detail on these in just a bit. Perinatal anxiety, feeling constantly worried, having intrusive thoughts, an inability to turn one's brain off, feeling as though your mind is a hamster wheel and it just keeps spinning and spinning. Perinatal OCD, having obsessive thoughts, conducting rituals, avoidance of obsessive stimuli. Perinatal PTSD, tension, nightmares, flashbacks of a traumatic event. And postpartum psychosis, which is rare. It impacts about 1 to 2 in 1,000 births, but it is an emergency and can include delusions, hallucinations, paranoia, and disorganization. This evening, perinatal psychosis. Now, this is an emergency, and when somebody is experiencing psychosis, this is somebody who 99% of the time, if not 100, needs to be hospitalized urgently. And psychosis is something that you cannot miss. It has a very distinct look and feel. This is when people are experiencing delusions or strange beliefs that feel real. We call them fixed false beliefs. They're having hallucinations. They're either seeing things or hearing things that are not there. They're feeling confused. They're having a hard time communicating. They're feeling disconnected from reality. They have a decreased need for or inability to sleep. They haven't slept in days. They are feeling a sense of paranoia and suspiciousness, right, towards friends, family. They perhaps think that they're being watched, followed, difficulty communicating, as I mentioned. And this is an absolute emergency and requires hospitalization. In the postpartum period, if PMADs are left untreated, we can have higher incidence of preventable infant disease and death, higher SIDS rates, infant failure to thrive, limited bonding and attachment between mother and baby, and over the long term, this can have a whole host of neurological and behavioral developmental issues for that child. And in newer expecting mothers or birthing parents' inability to care for herself or for the child. So there's 2 standard screening instruments. The gold standard is the EPDS, the Edinburgh Postnatal Depression Scale. It's 10 questions. A woman can score anywhere from 1 to 30, and 30 being the highest. Now, for us here at the Motherhood Center, we consider anything over a 10 to be the potential of a PMAD. And so we take anything over a 10 very seriously, and certainly as we see numbers getting into the higher teens and 20s, this is a woman who is most likely experiencing a very severe and acute PMAD. The PHQ-9 is also an instrument that many providers are starting to use more and more. That's the patient health questionnaire. And there are some practices that use the PHQ-2. That's the patient health questionnaire 2. It's 2 basic questions that get at little interest or pleasure in doing things or feeling down, depressed, or hopeless. A lot of times providers will use this kind of as a baseline, and if a new or expecting mother answers yes to either of these, they will then subsequently use the PHQ-9 to test further.